Hi, this is Mitch Sturgeon, the administrator for the ibot experience page. And I've got with me a couple folks from Mobius Mobility today, and I'll introduce Luke Moreau. He's the CEO. Go ahead, Luke.
Hey, Mitch, and thanks for having us. I'm here today with Jill Kalzinski. Jill is our Director of Reimbursement and Product Strategy, so she's our resident insurance expert. I'll cover a lot of the content today on some of the questions and concerns about the prescription requirement, but we've got Jill on in case she needs to clarify anything that I bring up, or Mitch, if you have any questions that you want to pass on either from yourself or from others in the ibot experience group. And Mitch, thanks for having us and allowing us to get on and to try to clarify what this is all about. So I guess first I'd like to say, we've heard the concerns pretty loud and clear, and we certainly understand that folks are frustrated. And I want folks to know that in addition to us hearing that and doing our best to address those concerns, that this really wasn't our idea. We're just trying to comply with some different regulations that come from the federal government and different agencies in the federal government, and even state and sometimes local and city regulations that we're required to adhere to. But that being said, there's a lot that we can do and that we already do to take a lot of that work off the user. And I want to cover that as part of this conversation, because it doesn't need to be so burdensome or maybe as burdensome as people might have think they've heard. So we can help with it. So first off, regarding the annual prescription piece, it's important that people understand that you don't need an annual prescription to keep using your ibot. I think I saw something on the Facebook group page that made reference to that, and that is not the case. Once you get your ibot and there's a prescription, obviously everyone knows, like any wheelchair, to get the device. But once you have it, you can use it for as long as you choose to use it without any further need for any sort of prescription. Where the prescriptions come into play is for service. And pretty much all the time, regardless of payer source, whether or not it's Medicare, private insurance, or unfortunately, even if it's cash pay, for different regulations that come into play, you're going to need a prescription. And it needs to be a current prescription, and that's defined in federal law as being within 12 months of the service provision, for example, essentially annually. And there's two reasons or areas where it's required. One is for the equipment that comes originally on the product, on the ibot, and the other is when there's something you want to add to the ibot. And for things that come on the original ibot, the initial prescription for the product that you get when you first receive the device is good for that first year. And then after the year, it's a good idea, we think, just to have a renewal in place with your physician, so we have it on file. Then if you add anything to the product that wasn't on the original configuration, then a prescription is pretty much always required, so we can process it. Now, as to the why and the source for this prescription requirement, it comes in at a number of different levels. One is for Medicare, and Medicare and Medicaid, by the way, but let's keep focused on Medicare in terms of the public health programs that we support. You have to have a prescription in place that is dated 12 months. It's currently valid within 12 months of us providing the product or service that you're requesting. Private insurance plans in the United States are all over the place generally, but many of them, I'd probably say, and Jill, correct me if I'm wrong, probably a slight majority to 2/3 say that they follow Medicare guidelines. And if they follow Medicare guidelines, the private insurance will require that we have an active prescription in place to provide parts and service.
That would, Luke, that would be correct. One caveat to that is there's a federal guideline for the 1 year that is outside of any sort of payer source. So whether it's Medicare, private payer,
that kind of governs it.
It overrides everything. So
got it. And in the case of cash pay, unfortunately, and I understand, I think it was Athena that raised this concern because she paid for her ibot herself without any insurance coverage, and being from the UK, she came here to get trained and receive it. We're a New Hampshire-based provider. We're required to be licensed, as funny as it sounds, as a New Hampshire pharmacy, because New Hampshire doesn't distinguish between pharmacy and durable medical equipment provider or anything else. They just lump it together. And under New Hampshire's licensing requirements for service components, we're required to have a current prescription. Now, the one thing I will say about this, if you look at it from where the regulators are coming from, there's a reason, and this stuff is very burdensome, and we don't agree to the level that they've taken it. It's very difficult for us to deal with. It's expensive for us to deal with, and it adds delay. We know that. But from the regulator's perspective and in the insurance company's perspective, and just from a societal perspective, unfortunately, there have been cases, and a lot of cases, where unethical providers have basically billed Medicare or billed private insurance for people who either don't need a wheelchair, or if they have one, can no longer use it, or in some cases have passed away, or in some cases there's just identity theft and non-existent users. And I'm talking to the tunes of, in some cases, billions of dollars. And so I think it was Athena, again, who said, I shouldn't have to prove that I still have a disability. My disability is permanent. That's entirely correct, and I get it. But there have been cases where someone's not using the wheelchair anymore, and the providers keep billing the insurance companies. And so they do, in fact, I think their motivation is to know that you still need the product and you still need the service for the product. You're still using it. And the only person who's qualified to determine that, since we're the provider, is your physician. Even in the case of cash pay, I'll give you a example of why you can argue this kind of thing would be needed. We have ibot users that don't have spinal cord injury or a condition besides just getting older and getting more frail, who love the ibot. We have many customers who get an ibot, pay cash pay, because they're just having trouble moving from getting older and frailer. Again, though, there have been cases, at least in the United States, of companies conducting fraud against senior citizens, convincing them they need to buy a product that they don't need, convincing they need service that they don't need. And in some cases, obviously, when people get older, they pass away, at a greater frequency than younger people. And some of these companies still continue to do that sort of thing. So there's definitely very much a fraud kind of prevention motivation to that. And that extends even to the cash pay portion, which I'm guessing is why you've got this overriding federal component on having a current prescription. Now, if a user wants it, we recommend that they contact their physician and just keep a current prescription on file. And they don't have to do that, but if they choose not to, it might add a little bit of delay. And whether or not they choose to, I just want to make sure people know that we can do that. And I think someone else commented, might have been Scott, I'm not sure, but someone commented that, hey, I don't think I've ever been asked to do this before. And the odds are that they did do it before, but the provider did it for them. The provider had a consent to contact the doctor. They handled it through the back channel with the doctor, and you just didn't happen to know. But the fact of the matter is, they should be doing it, and most likely they were doing it with the physician directly. That last point brings me to the consent form. I know some people had some concerns that we were making them sign an updated version of the consent form, which they'd already done the prior version with less information, and the new version has more information. That's one of the things we're trying to get, is that consent. So if we need to, if we're requested to, we can handle the prescription request, getting that on file directly with the physician, so the user doesn't have to. This is all, and someone asked as well, like, why didn't we have to do this before? And you could argue it might be, I'll take responsibility, that we could have predicted, we've been in operation now since 2019 without having insurance coverage and insurance claim processing. And as part of doing that, we learned what was required. And there's this whole process, which is very time consuming. Jill led it, to get accredited to even have the ability to basically submit insurance claims to either Medicare or private insurance. And in order to do that, you have to get accredited by an outside agency that's been approved by the government to audit you for your readiness to do that. And the one that audited us goes by the abbreviation HCHC, which, Jill, what does that stand for? I can never remember what it stands for. So it's accreditation.
I don't remember either.
I think it's Accreditation Commission for Healthcare or something like that. But they're an outside nonprofit. There's a few of them here in the U.S. that have been blessed by the government to do it. But HCHC audited us and gave us clearance. That was the announcement, Mitch, we made on the Facebook group page early this past winter about us passing accreditation and starting to be able to bill, some private insurance, which was huge news. But since they've audited us, then at any time they can return unannounced and basically say, we want to audit you again and look at your user files to make sure you've got the appropriate consents that are consistent with the accreditation. And the issue is our past forms did not have all the information that would pass the accreditation test. And so they basically advised us and actually provided the updated forms to say, here's what else you need to collect. It's things like emergency contact number and consent to contact the physician, in terms of HIPAA, information and asking for the prescription.
So does this mean, Luke, that if people wait for repairs to be necessary before getting a prescription renewed, that you would be missing out on that information that you just described?
Yeah. So it's not to say we can't. It'll take a little more time, and it just varies. It takes that out of our control if we're reactive, basically. Right. And some doctors are awesome. They respond same day or in a couple days. Some are not, and they may take a week or two or longer, and we may have to make more than one request. Or if one of the ibot users is doing it, they may have to make more than one request. But it'll speed things up if you have it.
Yeah. So. I hate to admit this in front of you, Luke, but I have another wheelchair and it needs repairs.
That second part doesn't surprise me.
and yeah, I had to go get a prescription for that as well. Yeah. So I think people are used to that. I think what turned people off is the idea that every year we're going to have to do this, when we expect the ibot to go for, in many cases, many years between repairs. So
and I think
that choice will be up to us.
Then. And I think maybe what got people upset is this: the people who already have their ibots and got them under our old process are kind of a little bit caught in the middle. And the people who get the new ibot, they only see one set of forms. The consent form is only asked for once, and if people would be so kind to complete the new one, it is very important to us, because when we get audited, they're going to be looking for that to make sure we've got the information. And so we don't want to have a problem with that. But once they do the updated one, it's a one-time thing. You never do that again. Like, we'll have it unless your information changes, or God forbid the regulations change. Yeah. But
one of the sentiments I heard was that, why do you need to know if I still need a wheelchair? I'm not getting, 99% of us with ibots are not getting better.
Yeah. And we know that.
Yeah.
We know that. But the federal government doesn't know that. And factually speaking, the numbers that I typically hear, 20 to 30% of Medicare's budget is fraud and waste. Yeah. Fraud and waste. And they're very aggressive, and they will definitely, it's not a question. We were told this when HCHC was here visiting us for our initial audit. We will get audited again for sure within the next 3 years, probably not long after, I would say probably in the next year is very likely. And it's important that we pass that audit, with flying colors, because if they find one thing, they could shut us down. They could say, you're not going to process any more ibot orders until you get this fixed. And God forbid they find something serious, there's fines and revenue clawbacks. They can put a company out of business. So you could argue we're being really, really conservative with this. I don't think we are. We're trying to be reasonable, and we're kind of stuck in the middle, trying to provide the best customer service and responsiveness we can, while trying to make sure we satisfy these regulations. So I guess I'll close with a couple other things, and then a request or two, if I could, of the group. We when we went through the accreditation process, we're required to be licensed in any state where we provide a delivery. So our home base is New Hampshire. We're licensed in New Hampshire. They have this requirement. We've been in contact with them before. We'll be in contact with them again about this. I would ask that, at least for the time being, the users don't contact the pharmacy board in New Hampshire, because it's a very small group actually, and we want to see if we can basically work this out with them and build some goodwill with them and see how they respond. If they don't respond, we'll be coming back to you and saying, could the ibot users please sign a petition or be in contact with them directly? But I think it would almost hurt the cause if all of a sudden the pharmacy board in New Hampshire was contacted by a lot of different people. And we haven't had the time to update them on this since it just happened last week. So I'm going to have that opportunity to see what they have to say. And in other states, it's not like New Hampshire's alone. The frustrating part for us is all the states are different. The state of Tennessee requires that we have a physical location in Tennessee. We can't afford to do that. And so we have users who literally either come here or drive to a state where we are licensed. And we do the training in a hotel conference room and around, some town or city that's across in another state. So we can do that and meet the regulations. That's kind of the links we're put, through to make this work. And I'll say that, this is one of the reasons, and you could argue one of the main reasons why there aren't companies like Mobius doing this. There's the big wheelchair companies, there's the big DME providers and companies that handle the insurance. There's hardly anyone that builds the product, trains the users on the product, services the product, and does the insurance on the product. And the reason we're doing that is we looked at going with these other people, but at every stage they want to mark the product up so they can earn their profit. And we wouldn't be selling iBots for $35,000 or $40,000 if we did it. It'd have to retail it more than twice that, and we wouldn't sell really any because affordability is already a challenge. So we took the path that we thought we needed to take to keep our costs low and get iBots to the people that need them, and that's why we're doing this. But we're therefore subject to all these regulations at all the different points in the chain. So we will talk to New Hampshire about it. We'll update folks. It may take a bit of time. And in the meantime, if you think you're going to be needing service, or even if you're not, if you want to contact your doctor yourself, please do. It'll smooth things out. And if you want us to handle it, complete that consent form. That's the other thing I can ask. If people could please, I understand it's extra paperwork, but that's why we need it. We're not just making it up, and we're not trying to make anyone's life difficult.
Sure.
And I guess on that last piece, when I come to the request, and I think there was a couple of questions some people wanted us to address in this recorded session versus the Facebook Live one we tried, is if folks could just assume a positive intent on behalf of the Mobius team, the Mobius employees, because that is in fact the case. And I understand it's frustrating. But our frontline employees, they don't make the rules. And we have a pretty strong self-selection bias here, where we're pretty much the only people who work here are trying to help. They don't like the way people with disabilities have been treated. They don't like the way the legacy wheelchair industry operates, and they're trying to help and do things differently. And so when they, even when the criticism frankly is valid, when they, get dressed down a bit, it's really upsetting to them. So I had a couple employees in tears last week when I was on the road, and it's understandable why people are frustrated, but please understand, we're not a typical company. This is not just a business to us. The ibot is not just a product to us. We're doing this because we're trying to help, and people on the group, I'm sure, know the original ibot failed, and it takes, I think, a special group of people that I'm very honored to lead, who want to take up that task again when they knew that a company like Johnson & Johnson couldn't pull it off. So it would be really helpful. And that's not to say you can't, have a complaint if you're not getting the service or the responsiveness you want. We're not perfect. We're going to make mistakes, but just to maybe approach it with that mindset that we're trying to do the best we can for you all. The second request I'd make is we really could use more support from ibot users in this group specifically, just telling the story, like being on social media, talking about how you're using the product, talking about what you can do with it, talking about how you can do things you couldn't do before with a regular wheelchair, and just spreading the word that it's of the things that it does and it's available and you can fund it. We still have a lot of people sitting back because they think they can't afford the product. And with insurance coming on board and with nonprofit partners that we now have very well-established relationships with that can help fund either a whole ibot if someone doesn't have insurance, or things like co-pays and deductibles if they do have insurance. The market's opening up, but the response to our insurance announcement, for example, Mitch, wasn't as positive, wasn't as active as I would have hoped. And I think people, if they would engage with us more to see, I get it. It's going to take some time and work on the user's part to engage with us, but we really would like to see more people engaging with us on that process so we can, build the company, grow the company, and also learn how we can flex on some of these issues and do a better job of serving you. So
yeah, I think the
with
community.
that, I'll be quiet. And if you got any questions or any questions that came in before
I think the community is very enthused with.
I hope so.
I rarely meet an ibot user who says it's gathering dust in the closet. These people, it's a life-changing product, and we just get frustrated because I think you might have been the straw that broke the camel's back with a couple of folks. We just get, as users, our lives are tough, and we get inundated with paperwork, and this one seemed frivolous, but now that you've explained it, I think we're not.
It's hard for me to understand, being able-bodied at a gut level, but I do understand the healthcare system, and I do understand the hoops it makes people jump through, and those hoops are higher and worse for people with disabilities. And it's never been our intention to make anyone's life more difficult. It really.
And I like to think these little snippets that we're doing at the website, at the Facebook page, are helping. It's the more we hear from you, the better we understand what you're going through to get us these ibots. So appreciate your time.
Support. I don't mean to be complaining about it. I just wanted we got a lot of folks who do amazing things. They're always on social media, and we're just trying to, probably, 95. Our marketing budget is tiny. Let's put it that way. We don't have a lot of money to spend on advertising. We don't have a sales team. And so we rely on word of mouth and users spreading the word. And I still have just a gut sense there's a lot of people who still don't know the ibot's available. And when they know it's available, they seem to think it's still with J&J, or it's not affordable. And we've made significant progress on, we're delivering in all, most states now. We're delivering in Europe, and we're getting ibots paid for. So hopefully people will hear that message and start, more of them will start.
All right, so let's invite people to comment in the comment section, ask some questions. Luke will try to answer as many as he can.
And hey, Jill, is there anything you want to add, or is there anything hopefully I didn't misstate anything, but anything?
No, I think you covered that very well.
Okay, thanks.
Yeah.
And I guess in closing, now that I know you're a licensed pharmacy, I've got some $70,000-$80,000 a year drugs that I'd like you to price out for me. So I'll be in touch. All right. Thanks for your time, Jill and Luke. And
then
thanks everyone.
Mitch, if people, I want to make sure people have a chance to ask more questions. So is the best way, do they post them on the Facebook group, and then
if they post it
there,
as a comment on this video that I'm posting today, then you can go in and respond to those questions in the comments section.
Okay,
I think that ought to work. If not, when people want to get in touch with Mobius about any issues like this, what's the best way for them to?
Yep. So really the best way, and I'm not doing that management thing of saying don't contact me, but the best way to start is to start with our customer experience team, because everyone has assigned or should be assigned someone particular to handle with these issues and ask questions. But if for some reason, that'd be my first place to go, is basically deal with the person who's working with you and knows your status and situation the best. But if for some reason, you're not getting satisfaction, you can always email me. It's elmero@mobiusmobility.com, the same format as other employees. And we're still a small company. We're 25 people. We sit in a big open office. I hear what's going on. you know, usually I try not to step in because I want folks to try to work it out themselves and keep moving forward on their own. But I do weigh in on occasion. And again, I don't want people thinking like they can't complain or can't, you know, file a grievance with us. That's totally okay. I just want folks to understand. It's more just understand when you start the conversation, we're trying to help and we're a small company awash in a lot of federal regulations. And, you know, the other thing I'll say is, you know, there's a lot of people rooting for us. There's a lot of people in the existing wheelchair industry that are rooting against us. We're kind of like the Tesla. We're going direct. The people who don't have that model do not like what we're doing. They don't not like it at all. And so that's why we need the support of our user community to keep pushing forward because we're gonna get their attention. We already are. So.
All right. Excellent. Thanks for your time.
Yeah. Thanks, guys. See ya.
Bye-bye.
Sounds good. Thanks, guys.